Okay, so let's keep this rather simplistic then, okay? So HIV affects the immune system. The immune system is responsible for fighting off infections in your body. HIV affects a type of cell called the CD4 cell count, preferentially, and it is because of the destruction of the CD4 cell count that the immune system then gradually deteriorates. Now this process of deterioration in your CD4 count takes many, many years. On average about 5 to 10 years. So a person with HIV can happily live a normal life, without having any infections for a considerable period of time. Now, rather than wait for that time to set in when the patient becomes, when the person infected with HIV infection presents with infections due to the reduced immune system of his body, it would be so much better if we found out that the patient was infected before that, because then by starting treatment earlier, it prevents the development of infections in the first place. What we often forget is that HIV not only through the gradual deterioration in the body's immune system, it just doesn't lead to infections, but also leads to development of cancers, and we often forget that. So, earlier diagnosis leading to earlier treatment prevents not only just infections, but also certain types of cancers which are caused by viruses, such as HPV-related cancers, so human papillomavirus cancers, so such as cervical cancer in women. Anal cancer in men is beginning to, it's gaining a lot of coverage in terms of one of the non-AIDS defining cancers in the HIV-infected population. Liver cancer, of course, related to hepatitis B and C as well, and Kaposi sarcoma, which is caused by a virus as well, and non-Hodgkin's lymphoma. So lymphoma is a type of lymph node cancer or blood cancer, which is caused by a virus called the Epstein-Barr virus. So these are increased significantly in the context of HIV, and we often forget that. So, as mentioned earlier, one of the main issues with the HIV diagnosis in Malaysia is that majority of patients are not coming forward. Those who are putting themselves at risk are not coming forward to getting themselves tested at an earlier stage. What that means for healthcare providers is that as a result, we deal with patients who are infected with HIV with late diagnosis, with more advanced immunodeficiency, and those with greater opportunistic infections. So it becomes more challenging to treat as a rule. And the prognosis overall becomes very much, the outcome becomes very much poorer. So really what needs to be done is firstly, to normalize HIV testing. It's to educate healthcare providers to think about HIV testing in situations where they would probably normally not. To educate HIV care providers to think about HIV testing in situations which would sort of ring alarm bells, why the patients are presenting with such infections. For example, somebody who comes in with a recurrent chest infection, maybe that should be a trigger for the healthcare professional to do HIV testing. But also scaling up of HIV testing services. Currently, few places are doing this. The community-based organizations, such as Pink Triangle Foundation, are offering same-day anonymous HIV testing. That's one way of increasing HIV testing, but it needs to be scaled up more. Not just from community-based organizations, it needs to be scaled up in primary care, and also in hospital settings as well.